Now, a look at what some hospitals hope could be a stopgap solution to the shortage of a critical piece of protection for those heroes on the front lines. They are N95 masks. John Yang has our report.
For healthcare professionals on the front lines of the coronavirus pandemic, masks like this, called an N95, are essential equipment.
The overall situation is terrifying. This is the closest thing I've done to going to war.
Sidney Longwell is an emergency room physician at Tulane Medical Center in New Orleans.
The patients that we are seeing are a threat to us. If you're going to go into somewhere where someone's coughing or you're putting a tube down someone's throat, you need a shield for your eyes, you need goggles, and an N95 as a basic minimum.
The virus has spread rapidly in New Orleans. Like the rest of the country, the city has a shortage of N95 masks. They're designed to block 95% of airborne particles and droplets that can carry the coronavirus. Before, doctors and nurses would use a new disposable mask for each new patient. Now,
we're issued an N95 in the morning, and you do your best to protect it.
When that practice began, Longwell started taking his masks home for a personal recycling program.
That's oldest and working way around to newest.
He sets them out on a table for at least 7 days, beyond what's believed to be the virus's lifespan.
This is our version of the Super Bowl. Everyone wants to stay in the game. That's why I'm recycling here, so that if the supply chain's cut, I can at least continue to work for a couple of weeks before I would have an issue.
Now, Tulane Medical Center and hospitals on Long Island, Boston, and other cities have developed official recycling programs.
We're in complete crisis mode.
Angie Birnbaum is Tulane's director of biosafety.
As a biosafety professional, I never thought that I'd be in a situation where we're actually questioning how to decontaminate an N95 mask, but this is where we are during this pandemic.
Tulane's program, which is awaiting government approval, uses a technique developed by Battelle Memorial Institute, a scientific research nonprofit. The Battelle system, which was approved recently for emergency use, treats used masks with vaporized hydrogen peroxide, which has been employed for years to sterilize sensitive equipment.
Vaporized hydrogen peroxide is a great decontaminant because it doesn't leave hazardous residues behind. You will basically have a nice sterilized piece of equipment that can be reused by our healthcare providers.
As a test of how effectively the system decontaminates, Tulane researchers add hard-to-kill microorganisms to the masks before the process. If those are eliminated by the vaporized hydrogen peroxide, they reason, so is the coronavirus. Not everyone is convinced. In a statement, the executive director of National Nurses United, the biggest union of registered nurses, said, "There is no validated scientific evidence that multiple reuse or decontamination of N95 respiratory masks is safe and will protect a healthcare worker." The Food and Drug Administration's letter approving the Battelle system for emergency use said its known and potential benefits outweigh the known and potential risks. And the National Institutes of Health said the results of its study indicate that N95 respirators can be decontaminated and reused in times of shortage for up to 3 times with vaporized hydrogen peroxide. If it is successful, the system would effectively expand the supply of usable masks.
You want to do hopscotch? Go, go. You got it, man. You got it. You got it. Go, go, go.
And it just could keep physicians like Sidney Longwell on the front lines.
When this started, and we were trying to figure out at what point we would tap out and say, if it gets to this point, I don't feel safe coming to work. An adequate respirator is where we all drew the line. I won't feel safe going into a room without an N95.
He says he's more concerned about his family than about himself. His father died of non-COVID-19 causes late last month.
The hardest thing for me about COVID so far has been not being to be around my mom. I'm literally a biological threat to my mom. I haven't been able to go to Baton Rouge to support my mom, and that sucks. Also, like, I've had a few patients die, and that's like...
Protecting loved ones, protecting patients, protecting themselves. The balancing act facing frontline healthcare workers across the country. For the PBS NewsHour, I'm John Yang.